A very warm welcome to everyone joining us live today for our webinar on malnutrition in India during COVID, hosted by the Oxford India Centre for Sustainable Development. I am Vinita Govindrajan, the administrator of the centre. We have with us today two speakers. Our first speaker is Dr. Anant Jani, who is the research associate at the Oxford India Centre. Our second speaker is Sahil Shah, who is an honorary fellow at the Jahn Research Group and specialist advisor at ALLFED, Alliance to Feed the Earth in Disasters. Our moderator for today is Lakshmi Santhosh Maithel, project steward at the non-profit organization Asha for Education. This webinar will look at the implications of the global pandemic on feeding India's populations and the solutions that we'll be implementing for the same. We hope that you find this session informative. Over to you, Lakshmi.
Thanks, Anita, and thanks very much to the Oxford India Centre for hosting this webinar. My name is Lakshmi Santhosh Maithel. I'm a project steward for Asha for Education, a grassroots organization that supports education initiatives in India. And a lot of the schools that we support right now are distributing food rations to vulnerable communities throughout India. So this topic is very relevant to us. I'd like to introduce our first speaker, Dr. Anant Jani, who is an Oxford Fellow and a Research Associate at the Oxford India Centre for Sustainable Development. He has also worked with Asha for Education London for a long time, especially our research initiatives, one in particular looking at how different strategies can be deployed to fix malnutrition in India based on the projects that we work with there. So please, Anant, we welcome you to begin your presentation.
Great. Thanks very much, Vinita and Lakshmi. Great to be here. And today I'm going to give a broad overview of some of the public health implications of nutrition in India. And really, in this sort of short talk, trying to convey that nutrition is actually a critical lever for India's sustainable development. So to start with, how do we actually keep our populations healthy? There was an epidemiologist named Geoffrey Rose at the London School of Hygiene and Tropical Medicine, and in 1985 he wrote a seminal paper called Sick Individuals and Sick Populations, which if you look at the link on the bottom here, you can get open access to the article. And basically what he looked at was looking at health and care systems. Oftentimes they focus on high-risk individuals because they're high risk. But what he said and found with his research was that if you're actually looking at the health of your entire population, what you need to focus on is controlling the causes of incidence of disease. So once an individual has a disease, it's already too late. But for many non-communicable diseases or chronic illnesses that we see in our rapidly westernizing societies, type 2 diabetes, heart disease, COPD, etc., obesity, all of these are not like infectious diseases, and they are reversible. And he created this very simple heuristic of looking at two normal distributions. So on the x-axis, you have risk of the population. You have low risk, medium risk, and high risk. And then on the y-axis, you have the percentage of the population that gets sick. Now, if we look at this pink curve to begin with, this pink normal distribution, we see that this group here, the high-risk population, is highlighted in darker red because this is where most health and care systems focus, because they're high risk. These are the individuals that are higher risk of heart attack, stroke, and other adverse events. But if you look at aggregate morbidity, mortality, and spend, it's always in this medium risk bubble. Because though they're lower relative risk, there's a higher number of individuals in this medium risk bubble, so you're always going to have a higher number of events here. And what Geoffrey Rose says is that if you want to improve the health of your population, you have to focus on shifting this entire risk profile to the left. And there's a few things that happen. One is now, relatively speaking, your entire population is at lower risk of adverse health events, number one. Number two, your relatively highest risk population is now in what was the medium risk category. And these risk categorizations are also important because they indicate the level of intervention needed to keep that person healthy. So for the high-risk population here, you need a greater and greater amount of intervention, whereas the medium risk, you need a lower level, and for the low risk, you need an even lower level. So when you shift the risk profile to the left, you also need lower interventions for what is now your highest risk group of people. So how do we do this, and what does health actually mean? So the title of this section was, how do we keep our populations healthy? So if we take a very basic sort of notion of health, we can look at length of life and quality of life. Now, there are debates as to whether these are the best measures, but there's something to start with, and we have some sort of standardizable metrics that we can use across different countries. And if we look at these two metrics, what I'd sort of point your attention to first is looking at clinical care. So clinical care, meaning access to general practitioners or doctors or nurses or hospitals, only accounts for 20% of health outcomes. The other 80% are due to health behaviors, social and economic factors, and physical environment. So these things have a much greater impact on health than just access to doctors and nurses and pharmaceuticals. And if we take another look at this, this is created by OFI, which is at the University of Oxford, and they created this multidimensional poverty index. And again, this is another way of sort of visualizing this. You have these three broad dimensions of poverty: health, education, and living standards. Now you can see some overlaps between this and this representation and the other ones, because all three of these are also essential in this other conceptualization. You also have education and employment and other living standards here as well. But from a poverty perspective, nutrition is actually quite essential. And that brings us to the next section. Where does nutrition actually fit in terms of sustainable development, and then also what India needs to be focusing on right now? So work done by numerous groups, including the Food and Agricultural Organization, which is a UN body, basically points to the fact that lack of proper nutrition in childhood can result in a profound impediment to the advancement of both individuals and societies, and it also slows the progress towards development goals. Now, this is sort of common sense, isn't it? Because if you're not able to nourish your children, the children are sort of the raw material for society. And if you don't have well-nourished children, you're never going to be able to have a strong and resilient society because the basic building blocks and the raw material for your society are not strong. And so when we look at malnutrition, I think these are just some very basic statistics, which some of you are probably familiar with. Malnutrition is the most important risk factor for illness and death globally, and that's not just in children, but in adults as well. It's linked to over 30% of all deaths in young children. Malnourished children, as per the previous quote, are at increased risk of infection, death, and delayed cognitive development. And if a child is chronically undernourished, that delayed cognitive development can also reduce their mental ability, their learning capacity, which will also have knock-on effects on their earning potential, and also the contributions that they can make to society, and also makes them more susceptible to chronic diseases such as diabetes, hypertension, and obesity. And the major causes are inadequate nutrition or feeding, poor health services, and lack of safe water and sanitation. Now, looking back at this chronic undernourishment, and particularly looking at the links between diabetes, hypertension, and obesity, and thinking back to Jeffrey Rose's curve, this is essential for any society to ensure that its children are properly nourished. And properly nourished doesn't mean that they're eating a lot. It means that they're actually nourished properly. So in the UK, for example, and many Western countries, we have childhood obesity epidemics. And though the child is obese, they are still improperly nourished because they're eating a lot, they're getting a lot of calories, but they're not actually getting the nutrients that they need to be healthy. And then finally, when we're looking at this in the context of India, over 30% of the world's children who are wasted live in India. So now, sort of the topic of the day, COVID-19. What does malnutrition mean in the context of COVID-19? Well, there's a few things, and Sahil is also going to touch on some of these. I'm going to focus on some of the health aspects. So this is OFI again, the Oxford Poverty and Human Development Initiative. And what they did a recent analysis, a recent meeting just a few weeks ago, where they analyzed vulnerability to COVID-19. So this is vulnerability to actually contracting the disease. And they looked at 3 risk factors in particular: malnourishment, access to clean water, and access to clean cooking fuel. And the reason they looked at these 3 factors out of all of the ones that you saw in their poverty index was because these 3 factors are associated with hygiene, weakened immune systems, and respiratory conditions. And also because malnutrition is linked to weakened immune systems, morbidity, and mortality in young children. So looking at these 3 factors would indicate the susceptibility of people in India to actually contracting the disease. And what they found was that nearly 1 billion people in India have at least one of these risk factors: malnourishment, no access to clean water, or no access to clean cooking fuel. And 60 million are at high risk, meaning they have all 3 risk factors. So that's the population of England. So basically, in India, the population of England has severe or high risk to contracting COVID. And of all of the countries that they looked at, India, so this is a sort of a heat map that they've created where red is bad, and what you can see is that India is the highest risk country out of all of the countries that they looked at. And then finally, thinking about actions and concrete steps forward for India, Sabina Alkire, who's the director of OFI, these are 2 quotes from her from a piece that she wrote or was interviewed for in the Huffington Post. And she's basically putting her money on malnutrition in terms of one of the key areas that we need to focus on to prevent morbidity and mortality in the short term, as well as the medium and long term. And for the short term, obviously because of the links and the susceptibility to COVID infection, it's essential that we keep our children and our the adults and younger adults properly nourished. And then also from the perspective that it's necessary for cognitive development, it would be a solid investment in India's future to ensure that India's children and youth are actually properly nourished. And based on some of the projections that they've done with historical data, what they sort of estimate is that a 10% increase in malnutrition from the already sort of abysmally low levels of proper nourishment in India would result in an additional 42 million people falling into poverty. And if malnutrition increased by 50%, we would see poverty rise by 187 million. Now, these are obviously just projections, but it's important to just realize the scale of the problem, and one of the most critical interventions that we can make as a country to ensure we can keep our children safe and healthy right now, and then also to promote the development of India in the future.
Great. Thank you very much, Anant, for that very helpful and insightful talk. I think, if anyone has any questions, please feel free to add them in the comment section of the live discussion, and we will address them after both presenters have spoken. Next up, I'd like to invite Sahil Shah. He is an honorary fellow at the Jahn Research Group, which is associated with the University of Wisconsin-Madison, and also a specialist advisor at ALLFED. He's been working on the collaboration between Asha for Education and Akshay Patra, another nonprofit that pool lunches to find solutions for the food crisis that can be deployed in the field. So without further ado, please welcome Sahil. Thank you.
Thank you, Lakshmi, for introducing me. There were a couple of things I wanted to touch upon and really look at a circle. So looking at the impact of malnutrition on COVID-19 in India, but at the same time actually looking at the impact of COVID-19 on malnutrition in India, and look at the interplay between the 2 factors and what the systemic impacts are, building upon some of what Anant said. So the first thing I wanted to touch upon was the impact of malnutrition on COVID-19. And publications all around the world, such as the IMJ, NCBI, and there's a particular paper from BMJ here in the UK that I really want to pick up on, which showed that those who were vitamin D deficient had an intensive care admission rate of 20 times as high as those that had sufficient levels of vitamin D, with a number of supplementary and supporting studies around the world confirming that for those who are nutritionally deficient, the probability of them dying of COVID is substantially higher. So in a country such as India, where the malnourished population is so high, the impact of COVID-19 is very much dependent upon the extent to which adequate nourishment is able to be provided. And at the same time, what I want to move into next before I move back to this is the impact of COVID-19 in India on malnutrition, and really looking at supply chain disruption. So the first part of supply chain disruption that I wanted to look at was actually looking at the whole food supply chain and what's happened in terms of goods. So obviously having lockdown for an initial 21 days and having that extended meant that food markets haven't been open as the way they normally have been. Cash has been provided out, food aid has been provided out. But if you actually look at the composition of the food aid that has been handed out, we're looking at much higher proportions of grain and pulses and much lower proportions of fresh produce, fruit and vegetables. As obviously you can't provide as many perishables because you're providing food for a longer time frame. And when you're not giving people these fruit and vegetables, you're having lower levels of micronutrient intake, and you're potentially exacerbating micronutrient deficiencies. These supply chain disruptions are potentially looking to persist over a substantive period of time, which is something that I'll move on to later. But the impact so far of just the supply chains has been really important when it comes to those who haven't received their adequate nutrition. And the next thing I wanted to move on to was fortification. Fortification, especially for the poorest and most vulnerable communities across India, is often how they get several of their key nutrients. Some of the fortification organizations I know on the ground, such as an iron fortification nonprofit, they fortify wheat flour, haven't been able to get their micronutrient mix that first needs to be manufactured, it then needs to be distributed and blended, but due to not being able to get people out on the ground outside of lockdown, they haven't been able to actually continue their operations. Operations means actually that the nutrients that people would be getting otherwise, they are no longer getting. And this is something not only harming current nutrition, but it will also have the impact of harming those who are most in need. And the next part to look at when it comes to the impact of COVID-19 is actually on the government response and lockdowns, which have been used to stem the spread of the disease, actually deprive the vast majority of the country from their natural vitamin D source, which is sunlight. And when people aren't able to access sunlight, their vitamin D over time, as has been seen during the past 30 days or so that India has been in lockdown. And this isn't something that is going to go away anytime soon. So looking at some of the epidemiological models, there is some belief in some parts of the world that if you're able to suppress the disease now, that we're not going to see a resurgence once you've loosened restrictions. But until we found a vaccine and until a vaccine is scaled, and quite frankly, to scale a vaccine across the whole of the population of India would take a number of years at the very least, is we'll most likely see either an easing and tightening of restrictions over time, unless we see an effective treatment come in. And if we do see this, then the supply chain disruptions and the other disruptions that we've seen so far will be set to persist, not just over 3 months, not just over 6 months, but potentially over sort of 1 to 2 years. And the extent to which this could contribute to protracted malnourishment is substantial. And the most concerning aspect when it comes to malnourishment is actually looking at fresh produce. And fruit and vegetable supply is typically especially vulnerable to disruption. I mean, here you have crops which are very labor intensive to plant. So if you need to have social distancing on farms, you're able to plant it at much lower levels than you would usually. And they're especially time sensitive to harvest as they spoil very quickly. So if you need to have social distancing on farms and if you have curfews, then the amount of produce that you're able to harvest is lower than it would be normally. And then again, when it comes to transporting these goods, when it comes to moving them across states, actually getting access to food markets, having the right type of storage available that means they don't spoil, this is something that will likely lead to lower levels of fruit and veg, not just production, but access at the same time, and ultimately lower levels of consumption, which again is the key source of micronutrients across much of the population, which paints a pretty dire picture, I must admit. However, there are things we can do. So first, I want to summarize some of the issues before moving into what we can do. So people need micronutrients more than ever, and the case for investing in improved nutrition is stronger than ever, both from a healthcare standpoint and from an economic standpoint. People will naturally be getting lower levels from their diets, as they'll be getting less perishables. The lack of sunlight in current lockdowns and potential future lockdowns will lower vitamin D levels further, and fortification has been disrupted, which we don't know how much longer this will be the case. However, fortification is astonishingly cheap, with a number of studies showing that for certain key nutrients, such as vitamin D, you can fortify a person for a year for 11 cents, which means that you could fortify the whole of vitamin D across India for only $150 million. Paupily sum for a country so large. And actually investing in interventions such as this at this point in time would be incredibly valuable, both looking at the short-term healthcare implications, but also looking at the longer-term economic implications. And a number of studies that have done across the developed world by companies such as BASF, looking at vitamin A, show that the ROI of investing in such countrywide fortification programs are very, very high. And the final thing I wanted to move on was a program actually that I've set up that we are running in a couple of weeks' time with the team that started the Coronavirus Tech Handbook, which was an open source project that scaled around the globe, pairing everyone from engineers through to doctors to design open source ventilators and helping save lives around the world. And we are working on a digital conference from June the 11th to the 13th, convening food system experts, risk people, other agricultural people, NGOs, to co-create a living handbook for countries around the world to use to avoid the worsening of our current food crisis. And you can contact us on hello@foodsystemshandbook.org or through the Oxford Somerville Centre if you want to come across to me. And that is initially all I had to say today. However, I'm sure many of you have seen the worsening of the Locust Crisis and the news reports that we've seen over the past 36 hours coming out of India, where we've seen the worst locust crisis, desert locust crisis, for over 3 decades. And when it comes to malnourishment, when it comes to food access, food production and availability, the impact on farmer livelihoods and the impact on access to fresh produce will be substantive. What's more concerning is that desert locust operations are complicated, needing often to get agrochemicals from one country, planes or drones from a second country, and actually having the right type of expertise. When, given the supply chain disruption we've seen with COVID-19, this is especially troubling, as because of this disruption, we've seen unsuccessful operations across the Horn of Africa, which has caused this spread. So the final thing I wanted to touch upon is it's not just the COVID-19 crisis that we're fighting, but the concurrent locust crisis, which is spread across to the west and northwest India. And early stage aerial and ground operations should be prioritized in order to stem that. Thank you. And back to you, Lakshmi.
Thanks very much, Sahil, for that very broad coverage. And yes, there are a lot of issues that are coming up. So I think we'll try to delve into a few of them in the process of the discussion. again, as I mentioned, if anyone has any questions, please feel free to pop them into the comment section of the YouTube channel. So I think the first thing that I wanted to pose to both of you, the first question I wanted to pose was about the role that nutrition does play in India's economic dividend and being able to achieve that demographic dividend from the population growth. So Anant, maybe if you could start just talking about how this malnutrition might get in the way of that.
Thanks, Lakshmi. So, I think the demographic dividend is India's future, basically, and that's around 300 or 400 million children and youth in India that will basically help to drive it into the next decades. Sort of as we saw with China several decades prior, they were able to utilize their demographic dividend to basically become one of the strongest countries in the world in terms of their economy and then also geopolitically, because they were able to provide educational support. They promoted women in the workforce. They got many, many more people into the formal labor sector, and they were able to rise out of poverty through that demographic dividend and the initiatives that they created for that demographic dividend. Now, obviously, the political structure of India and China are quite different, and India is a democracy, and historically, India has tried some things to improve and strengthen its demographic dividend, but probably not enough, certainly not as much as China, and it hasn't been as successful as China either. So I think in terms of looking at that demographic dividend, I think nutrition is essential, as per some of the slides from my presentation and some of the studies that have been done on cognitive development, etc. But in addition to that, other initiatives around basic education, etc., are essential to ensure that we have a strong young demographic that can actually yield a dividend. Because if we don't do enough for this 300 or 400 million children and youth, which are going to take us into the next decades, then that demographic will actually become a burden. And so I think it's actually quite essential that we in India start spending a little bit more time trying to support that demographic so that it does yield a dividend for the country. And I think just a very short nuanced point around that before turning to Sahil's thoughts. The state level heterogeneity and variation is also something that's essential, because India is not one country, and we have to look at the different states, and that gives us hope, I think, because some states are stronger than others, which means that having a strong young demographic is possible in the Indian context if the right policies and levers are put into place.
Great, wonderful. Sahil, would you like to add on to that? Also, especially looking at specifically how COVID-19 and all these issues that you highlighted associated with COVID-19 could interfere with providing the demographic dividend across states or within a particular context.
Yeah, so I wanted to build upon what Anant said actually initially around cognitive development, and to look at, from a context standpoint, where we are in the world today versus when China was experiencing this a couple of decades ago. And actually so much economic growth now was driven by technological development and driven by innovation. So looking at actually the quality of the labour force rather than just the quantity, so the human capital aspect. And actually, I think the case for investment in nutrition and that demographic dividend isn't just the sheer number of people. It's not that 300 million to 400 million people, but it is the extent to which that each of those individuals are able to achieve to the best of their abilities with the right access to education in order to be able to come up with the right type of solutions, with the right type of technologies, with the ingenuity that is required to develop the solutions that will take us from the world of today through to the world of tomorrow. And the impact of COVID-19 is complex and multifaceted, and we don't know how long this will persist. You have economists across the spectrum who are suggesting that this could be the worst depression that we have seen since the 1930s. And one of the concerns really is, I guess, looking at when you're trying to grow an export-oriented economy, which does seem to be part of India's growth strategy. What is the extent to which India will be hit, not just in the immediacy, but in the medium term, through to depressed demand across the US, across Europe, potentially in China as well? And what case is there for increased investment domestically, so you're able to switch out that international demand for domestic demand in a way a little bit similar to what we saw with the Japanese model post-World War II, when they had infant industry, and as they built up their economy internally, a lot of their export market then went to serve their domestic economy. And the final part really I wanted to touch upon when it comes to that in COVID-19 was, I guess, almost looking at what opportunity is there when the world is restructuring, and is there anything that could be done either at a policy level or a technical level to take stock? So what is the case to invest in now, which wasn't the case to invest in before? Because funds will not be as easy to come by. My colleagues in the humanitarian sector are talking about aid budgets being slashed by 20%, 30% over the next 2 years as Western economies continue to struggle. And actually the need for national investment into nutrition programs, into education programs, a Keynesian response, if you will, in order to inflate demand, is probably what will be required in order to weather the economic repercussions of COVID-19.
Great. Thank you very much for that. And I think I would like to come back to some of the policy components of this and what the government could be doing, since, Sahil, as you mentioned, it is going to be a 1 to 2 year problem, this ongoing food crisis. But we do have some interest in the comment section for the role of women in particular in addressing malnutrition, and that was also part of our title. So I've shared a link in the comment section about women's self-help groups in particular. But I think to start, Anant, if you could talk a bit about how women can be mobilized to address malnutrition in children and for themselves. And then Sahil, after that, you could jump in as well.
Yeah, so I think as a starting point, I don't think women need to be mobilized in the sense of we telling them what to do. They're already sort of doing it, which is, the World Bank article, I think, is really a testament to that. So, they didn't just wait and sit down for somebody to ask them to do something. They saw that there was a need in their community, and they just activated themselves and started doing stuff to a fantastic degree. So, I mean, looking at that World Bank article, you'll see that there's 67 million women currently who are members of about 6 million self-help groups. And they, in response to the crisis, started producing face masks, running community kitchens, delivering essential food supplies, and then also sensitizing their populations and their local villages about what COVID was and what their villagers should be doing. And the scale to which these women and these self-help groups worked was just phenomenal. So again, looking at that World Bank article, they made more than 19 million masks by 20,000 self-help groups across 27 Indian states, 100,000 liters of sanitizer, 50,000 liters of hand wash. And this is just in a few weeks. Nobody asked them to do this, and they just coordinated themselves, which I think is just a testament to how powerful they are. And they also set up 10,000 community kitchens across the country. And, obviously, if you're paying attention to the news, you'll be aware of the internal migration crisis. And, a lot of these people relied on the community kitchens that these self-help groups set up and started running as well. So, I think they have an essential role to play. And, again, it's just a testament to the fact that we didn't have to ask them, they just did it. So imagine if we were more supportive of them, I think they could do even more. So again, going to your comment about policy, I think if we could create policies to actually strengthen the infrastructure for these self-help groups, I think they could, do even more and drive even greater benefits for the populations.
Great. So, Sahil, did you want to jump in? I think there's also a question about whether the intervention should focus on women's education in particular, maybe within the context of some of these policies. Would either of you like to talk on that a little bit?
Sure, I'll jump in briefly, and I think Anant did a fantastic job on answering the question at the macro level, but I don't have a huge amount to add there, except I'd be interested to see what the potential was for the role for microfinance, as we're seeing, for example, with the Grameen Bank in Bangladesh, and whether similar type of programs could be used to accelerate the work of some of the women's groups that are currently being done. But on the micro level, I mean, across India, it is generally women who are making household decisions when it comes to nutrition, at the very least. And I think the role of women when it comes to nutrition and at the household level is critical. I don't generally think there's a lack of information in terms of what foods are generally healthy and what foods are generally not healthy. But I do think when it comes down to specific micronutrients, to ensuring that the particular deficiencies are addressed, and when it comes to education, I definitely think there's a role to be played, whether that is done through the state, whether that's done through private sector or on the ground NGOs, just to ensure that whether it's supplements, whether it's fortified goods, whether it's particular crops to be grown, which are particularly high in these few nutrients, I think there's a role there to ensure that there's adequate nutrition across both macro and micro nutritional indicators.
Yeah, absolutely. I think the next question, I think we'll stay with you, Sahil, is about what the role of food and agribusinesses specifically. I know you have some background in that, if you'd like to discuss.
Yes, and it's a very difficult time for agribusiness, as we've seen, for example, with some of the wheat harvests, where the wheat was harvested, but when the roads were blocked down, wheat couldn't be transported, it couldn't get to markets, prices were very high in urban areas, they were low in rural areas, there wasn't the room for storage, and then when we saw rains, we saw sort of mass spoilage of harvests. The role of agribusiness is critical, and actually the role of the state in supporting agribusiness is also critical. So, I mean, the first thing I do is I advocate for sort of food vouchers rather than providing direct food aid. And what's really critical when it comes to agribusiness is people keep planting. I've had reports of people not planting due to lockdown, due to fear of being beaten if they leave their homes. There could be fear of not planting now, given that we see huge swarms of locusts across sort of western and northwestern India. And I think it's the full end-to-end supply chain flow. So the agri-banks are critical in terms of ensuring that providing credit and liquidity to farmers so they can purchase agri-inputs. Again, the same goes for the seed providers and the fertilizer providers, where there may not be the financial means to do so. Is there anything that's able to facilitate that, whether through forward contracts, contract farming, whatever it may be, through to ensuring that the storage capacity in the supply chains, whether it's rail freight or whether it's trucking, is able to function during current lockdown, but also potential future lockdowns, because farmer confidence is incredibly important to make sure that sufficient planting is done, to make sure that crops are harvested where they need to be harvested and they're distributed where they need to be. And this is especially important to keep food prices low. I mean, we've seen global rice prices recently almost as high as we've ever seen, and there is the potential for them to go even higher. So agribusiness is especially important, and if it hasn't, it should be declared sort of key critical industry on a national level.
Yeah, yep, definitely a lot of challenges ahead for them. We do have a question regarding responses across states, whether you have noticed anecdotally or with research the differences between how women are responding in southern versus northern Indian states, and whether this can be tied to what sort of resources are made available to them, or inputs from self-help groups on how to access micronutrients, seeds, and water. And if you either of you have any comments on that, I think that was the last question related to women in particular.
So on the women, just one other quick thing on the education. So completely agree with Sahil that I think education is necessary on micro and macronutrients and what is healthy for their child. And I think in addition to that, they also need to be educated about self-nutrition. So a lot of NGOs and policy initiatives are driving them to breastfeed their children without actually providing any additional nutritional support for the women who are breastfeeding, which basically means that they're putting themselves at risk to feed their child. And for subsequent children, their bodies are not going to be as well nourished to actually support the subsequent children as well. So I think not only educating the women about nutrition for their children, but educating women about nutrition for themselves as well during pregnancy and during different time periods of their lives, I think is essential. And anemia is rampant in India, so I think they need to understand what iron is, why they need it, and where they can get it from. On the self-help groups, super interesting question. I have no idea. My suspicion is that there will be intra as well as interstate variation. Intra meaning different districts within a state. But I don't know any of the details about that. But super interesting question. Maybe Sahil, or maybe, I don't know, I don't want to put Vinita on the spot, but since it's an open discussion, maybe you guys know something a little bit more about this, but very important question.
Great. We have another question regarding the midday meal scheme, since it's been stalled across multiple states. Are there any suggestions for how this could be resolved? Either, Sahil, if you've discussed any plans with Akshay Patra that offers midday meals, have there been any solutions proposed on that front?
Good question. I haven't actually had a chance to have those conversations in depth, but I do think they're challenges, and I think it's balancing the healthcare implications in terms of social distancing with the ability to feed significant numbers of people. The anecdotal reports of what I've seen so far means that I think from a food standpoint, they've actually been done relatively well. I think a lot of the meals that have been provided at large scale, not just from Akshay Patra, from non-profits around the country, the government themselves, have been very timely and they've been much in need. But the ability for them to be administered in a safe and secure way is something that should really be thought through when it comes to future lockdowns, which may well be needed to quell future outbreaks. And sort of bringing it back to agribusiness before, I'd be sort of a very strong advocate for food vouchers, which could be used, which are a lot easier to disseminate, and it means people can go to a wider variety of existing agribusinesses and use those vouchers, which would not only maintain the purchasing power of agri-industry, but at the same time, it would most likely enable greater social distancing whilst ensuring that people are able to secure and maintain their food access.
Yeah, wonderful. We have another question about agribusiness as well, specifically international agribusinesses and what they could be doing within the country. And this could be a point to talk about trade policy as well, Sahil, if you'd like, and how the food crisis in India works within an international context, whether it's bringing food in or bringing businesses in that can help alleviate the situation.
Yeah, and a really great question, actually. I think the role of international agribusiness is really important, and I think international agribusiness has most certainly made mistakes in India in the past, and I think it has an opportunity to rectify and remedy those errors. So, I mean, the obvious place to start is agri-inputs. So, for example, subsidized agri-inputs on longer-term contracts, going back to sort of seeds, fertilizers, crucially pesticides. Actually, pesticides I haven't spoken about a huge amount, but given the current locust crisis, the scale at which pesticides will be needed I don't know the Indian pesticide sector well enough, but I do think given the scale of the crisis, it will be likely that that will need to be bolstered by international agribusiness, whether that comes from Europe, such as Germany, whether it comes from China, whether it comes from the US. So I do think when it comes to the Locust side of things, both when it comes to expertise and when it comes to actual goods being provided, international agribusiness have a huge role in quelling the locust outbreak, as well as providing the right type of agri-inputs to farmers. And on the other side, it's about farmer livelihoods. Obviously, India is the world's largest rice exporter, and there are tens of millions of rice farmers that are dependent on these rice exports for their livelihood. And these are often bought by major rice businesses around the world. So I guess there it's not so much the role of agribusiness, but it's just facilitating the ability for agribusiness to be able to do so. So any type of export restriction, say for rice, could have severely negative repercussions across rice farmers throughout the whole of India. And I think when any policy is being made, it should be made with that in mind.
Thank you very much. Anant, if you were able to talk a little bit about policy, could you recommend any policy changes that would, shift the population health curve in a direction where there's, fewer people in a high risk situation, or the high risk people are not as severe? It'd be great if you could talk a bit about any policy recommendations you have on that front.
Thanks, Lakshmi. I suppose going back to the Akshay Patra, what they're doing, I think what they've been able to do is to get some funds from PDS to actually then produce more meals for children. And I mean, very briefly, if I was to come up with something or some recommendation, I would just say to give a little bit more money to PDS as a starting point. So I think it's been less than 2 crores, which is much, much less than the government has allocated to businesses. So I would probably put my money on that if I was to look at one simple policy initiative that they could do. And then at a state level, obviously this is probably too much, but looking at monitoring and then trying to ensure that the people that need the food are actually getting it, because PDS supply chains are quite heterogeneous, and in many states they're actually quite broken as well. So,
could you give a little bit more background on PDS in particular for those who don't know?
So the public distribution system is a welfare initiative started by India many decades ago, and it provides subsidized rations of wheat, rice, oil, sugar for families in need. And I think you get a ration card that you can use. And I think it's actually, I don't know the details about when it's updated or when it's sort of renewed, but you can then go to a shop and use the PDS card, the ration card, to actually get some of the rations for yourself. So I think doing something like that, and maybe creating other supply chains to ensure that individuals actually get their food. So maybe doing delivery trucks and these sorts of things, to some of Sahil's points about distribution, might be quite powerful, I think.
Great. So I have another question regarding vitamin fortification. We've talked about how malnourishment can actually lead to the spread of disease or make people more vulnerable to disease. Has there been any research done really effectively showing how a particular type of vitamin fortification, for example, could address spread of disease, or have the outcomes been more focused on increasing life expectancy, or even increasing school attendance as a metric of nourishment? So what are your thoughts on specifically targeting reducing infectious disease as an outcome of nourishment? Either of you, I'll open it up. Jump in.
Sahil, do you want to, I guess, just very briefly, I think iron, looking at anemia, I think is essential. And then you have some of the other, you have the macronutrients, again, as Sahil mentioned. So ensuring protein deficiency is a big thing. So I think looking at just ensuring that they have enough protein in their diets, then just basic numbers of calories. And then going to iron, zinc is as well, and then I think vitamin E, C, and A. Probably, but Sahil I think is much more expert in the fortification sphere than I am, so I'll turn over to him.
I wouldn't say I'm an expert in the fortification sphere, but I do think there's a role when it comes to severity of disease, more so than spread of disease. And I guess to answer your question, there are a number of studies that have been published worldwide looking at the impact of particular vitamins and their deficiency on severity of COVID cases. The one that comes to light, and I would caveat it, that it is correlation rather than causation, is sort of vitamin D, and specifically sort of the ability to buy D3 supplements, D2 supplements, more likely in India, given that D2 is the D3 is actually made from. So then again, the case is fairly clear in terms of you're able to look at the cost of a nationwide fortification program. If you're estimating that over the course of sort of 2 or 3 years that 80% or so of the Indian population would get COVID-19 before herd immunity, the epidemiological models are there when it comes to the expected number of deaths that are there. And if you're able to model, say, vitamin D it's quite fat soluble, and say providing it to the largest oil millers in the country, that's I'm not quite sure what the market concentration ratio is, but if you were able to access, say, half of the population and reduce the likelihood of deficiency by a substantive proportion, it would be quite easy to make the case and model the numbers when it comes to the actual cost of a fortification program versus the number of lives you could actually save. And I am actually working with a team who are doing this at the moment across the Horn of Africa. I'm hoping to have these numbers for you shortly.
Great. And we have one last question regarding how we're working to involve other policymakers, whether we're sending a recording of this discussion to them, or if we're finding other ways to reach out. Either of you, Sahil or Anant, on that point, or even Vinita, if I'm sending this recording to them.
Well, in the short answer, no, not formally, but I think we need to. We are thinking about it, but thinking is not action. I don't know if the OICSD. One thing that we have discussed internally with some of the people in the OICSD, the Oxford India Centre for Sustainable Development, is to come up with a sort of overarching sort of response to COVID-19 in India. We haven't come up with that formal plan yet, but that is something that we're working on, and that will probably be our slightly more organized response to this, but Vinita is probably much better placed than me to discuss any of those particulars.
And I guess on my side, there's sort of 2 or 3 different places. So I'm in conversations with a couple of governments, not India, but others, in terms of advocating for fortification programs at this point in time. And will likely a few more others in upcoming weeks, as well as a number of multilaterals, as well as doing some of the horizon scanning, not just how this could get worse in India, but how the COVID-19 crisis and the Locust Crisis could get worse elsewhere. So a lot of the findings from this and a lot of the other work that's being done will most certainly be discussed with policymakers across the multilateral, across the government sphere, and across the aid agencies as well, so across sort of a wide variety of stakeholders.
Wonderful. Thank you both very much, Anant and Sahil, for your knowledge and your time today and sharing all of your insights with us. I think we're getting towards the end of the hour, so I just wanted to wrap up a little bit with some information on Asha for Education as well. If you'd like to volunteer with Asha for Education, you can email us at london@ashanet.org, and I'll post that in the comments as well. And you can also donate to our current fundraiser to support people distributing food rations in India. and that includes a school that I'm the project steward for in West Bengal that was recently hit by the cyclone. So that information is in the link as well. And again, if you contact london@ashanet.org, we can loop you in on any of the events that we're organizing, or if you'd like to work on the research, hackathon. Sahil has been organizing hackathons on different topics in collaboration with Microsoft and Cognizant, where teams work on solutions that can be deployed in the projects that Asha for Education supports. So there's a lot of different ways you can help, even organizing events like this. And I think we're having a meeting, a virtual meeting coming up in June. So if you email us, we can provide you details at that meeting as well, if you'd like to be involved. And again, please support our fundraiser as well. Thank you all very much for your time, and I'll hand it over to Vinitha. Thank you. Vinitha, I think you're on mute.
Thank you, Anant and Lakshmi and Sahil. That was a really informative and insightful discussion, and so much that connects with what we're doing at the Oxford India Centre for Sustainable Development, and so many more themes to be picked up and discussed further, perhaps in future webinars. I just wanted to invite everybody to have a look at our term card, which should be displayed right now, and to attend our future events, a lot of them related to similar themes on climate change and COVID. And I also wanted to invite you all to follow us on Twitter at the Oxford India Centre, and do take a look at our previous events and seminars in the newsletter link, which is there in the description below. So thank you once again for joining us today, and hope to see you again soon.